Well, welcome back. We want to talk about something that's very important for new moms, breastfeeding, where you can do it, how important it is for an infant's health. And joining us to do that now is Valley Stream State Assemblywoman Mikhail Szilagyi and Dr. Susan Verschalik. Welcome to our show. Dr. Susan Verschalik is the head of the New York State Breastfeeding Coalition, also the medical director for the New York Milk Bank. And let's begin there, Dr. Verschalik. What is the New York Milk Bank? What does that do? I don't know that a lot of people even knew we had one.
Okay, well, the New York Milk Bank is one of 22 nonprofit milk banks that exist throughout the United States and Canada. We're a nonprofit bank, and we accept milk that's donated by mothers who have extra milk. So after they're carefully screened. So they go through a medical screening, they're accepted as a donor, a blood test is involved as well, and so then they donate their extra milk to the milk bank.
Why is that needed? Why do we have a milk bank for that?
Well, as you probably know, breastfeeding and mother's milk are the perfect food for any infant of any age and stage.
Numerous studies have proven that.
Oh, sure.
Right.
I mean, the evidence is very solid on that. We know that breastfeeding mother's milk helps reduce infection and reduces the risk of many long-term problems as well. It actually interacts with the immune system in the brain, so helps reduce things like diabetes, allergies, and promotes stronger brain and immune system development. But it's the premature and sick infants who are really the core recipients of the milk from the milk banks.
The ones who need it the most. And that's where the Assemblywoman comes in, who's teamed up with you. Both of you are now calling for the state to boost the donated breast milk supply. Explain that and what the issue is there.
As I said, breast milk is liquid gold. And in New York, we're always looking ways to help better our youngest New Yorkers. And so why not help our preemies and our infants who need that extra breast milk, that medicine that will help them grow. And so we've put in legislation to have financial support for mothers who are not able to produce breast milk so that they can get the donated breast milk and give it to their infants.
And that's not uncommon, that women are not unable to produce breast milk. It does happen to a fairly high percentage.
It's
compared to us thinking that none at all would.
The highest percentage really are among those who have sick and premature infants. Right. Very often when a mother gives birth to a premature infant or an infant with a medical problem, she has a medical issue herself, or there's a complication. So those mothers are at especially high risk to not produce enough for their infants.
Well, I think you'd get a pretty strong agreement from folks out there that we should have this. Where is the issue coming in that we're not able to get the donated breast milk?
It's a bipartisan issue, but we don't have a breast milk bank established yet in New York State. They're opening up the breast milk bank soon, but we import our breast milk, and on average it probably costs about $4.50 to $6 an ounce.
That's fairly expensive.
It's expensive, and so many families don't really have access to financial support to afford that.
You mean this is an income equality issue? Explain that.
Exactly. As a new mother myself, it was very difficult to breastfeed, and so I needed a lot of support. And so being able to support working mothers here in New York State by providing breast milk, good pasteurized quality breast milk, will help empower all families here in New York State.
Well, you hear donated and you think, wow, there couldn't be all that big a cost to it, but apparently there is. And is insurance not covering this, or Medicaid, if people are low income? What's the situation there?
So we don't have it yet, but it's been passed by the Health Committee of the New York State Assembly with flying colors. Everyone, Republicans and Democrats, support it, and it's going to come to the floor soon. And I'm confident that we'll get it done here in New York State.
Well, is that the situation, Dr. Verschalik, that the insurance companies and Medicaid do not cover this currently?
Currently they do not. There are a few states in which it's covered. In New York State, most of the hospitals that use donor milk absorb the cost for it. Again, when supplementing a tiny premature infant, although it sounds like it's expensive, when you look at the overall cost and the overall cost, say, of providing IV nutrition for that same infant, it's comparable, and the return in preventing complications and helping to shorten hospital stays will ultimately save money in the long run.
And do we have a situation where if someone does have income or wealth or finances to buy this breast milk, they can versus someone who can't? Is that what the situation is now?
Yes, if someone has the money to purchase donated breast milk at $6 an ounce, they can easily access it through other milk banks across the state or the country. But you know, this is a way to ensure that we lessen the health disparity and that we empower all New Yorkers.
Do you think this will pass?
Definitely.
So you're finding this is a bipartisan issue?
It's a bipartisan issue. We want to care for our youngest individuals, and we find that in New York State we're always looking for ways to decrease diabetes or solve some of these health disparities that we have. And breast milk is that liquid gold, that medicine.
Well, now, you know, for some time here in New York, it's been known that women have the right to breastfeed anywhere they want. I don't know if they fully, sufficiently understand that. Do you think that women understand the rights they have, Doctor?
Some do, some don't, but I think not all of society understands that. Many women that I encounter every day say, you know, they understand they have their right, but they're not comfortable. I see many women who come from different countries who say, oh, in my home country, it's easy. Nobody stares at you when you breastfeed your baby.
It's just part of normal life.
Yes.
But here, so it's a little different here, and it's
same.
still taking time for this to maybe be accepted by the culture and even by women themselves. So they need a more private place, probably.
Exactly.
For some moms, you know, it depends on the mom. For some moms feel very, you know, strongly that this is their right and they will breastfeed in public, but some just feel more modest, they're uncomfortable, so... Well,
that's behind the other bill we're talking about here, trying to get it at airports. Explain the current situation.
Well, you know, when you go to the airport, it's not like an hour or 2 hour endeavor. It takes a very long time, 6-7 hours. And so, you know, currently in the largest airports in New York State, we don't have lactation accommodations or just a single room where a mother can go to either pump breast milk or nurse their child.
There's a private one that I'm aware of in some of the airport. That not sufficient?
And it's, you know, they're not sufficient. They're one, and you know, a lot of the major airports don't have it. JFK has one in one terminal, but we need to expand access to all the terminals so that, you know, mothers can have a place to comfortably do.
What kind of response are you getting? I'm sure there's an expense and a cost to this and a space issue for the airlines and the airports. No? Well,
since 2007, we enacted legislation in New York State to protect mothers upon working, to make sure that they can breastfeed. And so I think this is a natural step to make sure that when traveling within an airport in New York State, they have a place to breastfeed.
Well, now you know the folks who are on this issue and trying to do something about it. We want to thank you for coming in and explaining it to those of us who didn't know anything about it, Valley Stream State Assemblywoman Mikhail Solage and Dr. Susan Vershalek. Thank you very much for joining us. And we'll be